So pharmacists, this is especially for you if you're planning on studying for your OET, that's your Occupational English Test, to be able to work as a pharmacist in places like the UK and Australia. Perhaps you don't really know too much about it and want to find out more. My name is Sona from Bose Learning, and I'm a premium preparation provider of the OET. Watch this video to find out exactly what the OET is and what to expect in the test. This is actually a preview lecture from our on-demand courses on Udemy, which I'm currently writing for pharmacists as we speak. By the time you watch this, it will either already be done or it will be coming very, very soon. If it's already done, you will find a great discount for the course in the information below. And if it's not yet done, don't worry, because there's still a discount you can get on our reading course, which is available for everyone. In any case, we hope you enjoy this. And also, once you finish watching this, why not subscribe to us and follow us for more fun quizzes to help you with your OET and further practice. Well then, let's start at the very beginning and the format of the OET itself, and we'll focus especially on what it means for you as a pharmacist. What is the OET then? Well, the Occupational English Test, or OET, is an international language test, and it's designed especially for those in the healthcare profession. So whereas the IELTS focuses on academic skills and looks at seeing how well people perform in an academic or general English setting, this time you're looking specifically at how well you perform in healthcare professional settings. That is exactly what you do every day in your jobs, but this time we're focusing on how you do it in an English-speaking setting. The test itself covers all 4 skills. So in that respect, it's like the IELTS. It covers listening, reading, writing and speaking, but it explores communication typical of workplace scenarios. So for you pharmacists, when you're speaking in the role plays, you'll be speaking to an interlocutor who will take on the role of a patient or a carer who's coming in for advice, perhaps about a change in their medication, about a problem that they're presenting with, or they just want some advice on something like weight loss or going on holiday. Now, the listening and the reading tests are exactly the same for all test takers, but the writing and speaking are profession specific. The OET qualification itself is recognised by boards and councils across the world, and there are over 107 test venues in 40 different countries, so hopefully you'll be able to find a venue near you, or you may be able to take the at-home test if that's available. How is it marked? Well, you're given a band score between E and A. And what we want to focus on is a band score of B, which is what most pharmacists need to be able to practice. This means that you will get a numerical score of between 350 to 440. And what that means is that you can communicate effectively with patients and health professionals using appropriate register, tone and lexis, and we'll be looking at all of these things in the course. Maybe you make a few mistakes and you hesitate a little bit, but it doesn't really impact on the overall meaning of what you're saying and what you're communicating. You show a good understanding of a range of clinical contexts. And that's an equivalent of 7 to 7.5 in the IELTS. Why do they give you these 10 band score differences? Well, that's to guide you really, because you know if you're getting 340 correct, then you just need a little bit more of a push to move over onto that band score B. Whereas if you get 300, then you need to do a bit more work, perhaps in language building technique as well as actual test taking skills. This course is going to focus mostly on test-taking technique and vocabulary and language that you can use in your speaking role plays, and of course going beyond that in your everyday lives. As I say, the test is scored between 0 and 500 in 10-point increments, and for most test takers a score of at least 350 is needed, which translates to a B. Be a little bit careful though, because to get 350 out of 500, it doesn't mean that you need to get exactly 75% of your answers right. There's a complicated algorithm that goes into it, and there are various ways that this is worked out, but you should be aiming to get at least 360 to be comfortable before taking your test. How long do I need to study? That's the big question that all my students ask me. Well, that really does depend on your level of English, because after all, it is an English language test. It's not testing your clinical knowledge, but your English language skills. So you need to have a good foundation of grammar and an extensive vocabulary. For someone who's achieving around 300 to 340, so you're a little bit shy of that 350 band score B, then the OET recommends you take a further 40 to 150 hours of guided study. And you also need to develop your test-taking techniques, such as skimming and scanning. We recommend that you start preparing for the test when you have achieved a high B2 or C1 level. I hope you found this introduction into the OET useful. Don't forget to click on subscribe and follow us for more information and fun quizzes for the OET. Why not do a little bit of reading practice right now? We've got reading practice for you on Part A, Part B, and also reading Part C style questions. As well as that, we've also got our Upgrade Your OET vocabulary quizzes. And some of them are especially for pharmacists and have a speaking role play just for pharmacists too. Thanks for watching. See you again next time. Bye bye.